All right, so this lecture video is part 1 for chapter 14 in your Pharmacology for Technicians textbook. Chapter 14 covers the endocrine system, or hormonal disorders and their treatments. So the endocrine system consists of glands and other structures that produce hormones. So our hormones are responsible for specific regulatory effects on tissues and organs. The target is of your hormones is the actual tissue that is affected by the hormone. So if you look on slide 6, it actually shows you the different body parts or glands that are associated and how they play a role within our bodies. So obviously growth hormone is directly related to bone growth. The adrenocorticotropic hormone comes from your adrenal cortex. They actually call that the stress hormone. Your adrenals sit right above your kidneys. The thyroid stimulating hormone is from your thyroid gland. It produces TSH, which is the thyroid stimulating hormone. The gonadotropin hormones are released in the testes in males and ovaries in the females. So, for instance, with females, the FSH, which is follicle stimulating hormone, that is something that is produced in the ovaries. So, your melanocyte stimulating hormone is actually a hormone that works with your skin. Prolactin is a hormone that's released in your target areas within your mammary glands for females for breastfeeding. Oxytocin is also a hormone targeted for mammary glands, but also within the uterus. The oxytocin is actually something that happens naturally during childbirth. When the oxytocin hormone is released, that is when our bodies go into labor. And then the antidiuretic hormone known as ADH, that is actually produced within the kidneys or targeted within the kidneys. So your thyroid gland is responsible for the production of T3 and T4. Those are the two versions of thyroid. So your pituitary gland will release the thyroid stimulating hormone, or TSH, to the thyroid, and that is a communication to the thyroid gland that your body needs to, or the thyroid gland needs to release both T3 and T4 into the body. So when that doesn't happen, or a lack of or an excessive amount of T3, T4 being released, or too much of the thyroid stimulating hormone being produced, we can have certain conditions that happen from that. So it says for hypothyroidism, so conditions in which the production of thyroid hormones is below normal. So hypo, so just like with high blood pressure, hypertension or hypotension, it's the same thing. Hypothyroidism is too little, too low thyroid in the body. So different causes. There's been an autoimmune destruction of the thyroid gland. A patient has maybe had radioactive iodine therapy. They actually surgically remove the gland, maybe because of a tumor, and then either pituitary or hypothalamus dysfunction. So treatment of hypothyroidism. One of the most common that you're going to see is levothyroxine. That's the generic version of either levothyroid, Levoxyl, or Synthroid. This is used in chronic treatment of hypothyroidism. There is an increase in cardiovascular events, side effects such as increase in chest pain. They can have an increase in heart palpitations. And an increase in sweating. And then liothyronine, which the most common brand name that you'll see is Cytomel, that is used to treat both hypothyroidism and goiters. So hyper is the opposite. This is a condition where the thyroid hormone produces excess, too much. It's also called thyroid toxicosis. So causes of that could be Graves' disease. They can have nodules or tumors on their thyroid gland. Also tumors or nodules in the pituitary gland. So symptoms, usually it's like a sudden rapid weight loss. They can have hair loss, exophthalmos, which is where there's a fat collection behind the eyeball, which causes a protrusions of the eye, so basically kind of pop out. The further that they pop out can actually cause or lead to corneal ulceration. There's a picture of what someone like that looks like, or someone that has that condition in your chapter. So treatment of hyperthyroidism is surgery. So they can remove or reduce the function of the gland. Ablation, which is used to destroy the thyroid gland using radioactive iodine. Short-term suppression of thyroid hormones. So there's only 2 drugs that are categorized or are used specifically for hyperthyroidism. Propylthiouracil, this one's a tongue twister. Propylthiouracil is one of them, and methimazole. So there's only 2 drugs used to treat hyperthyroidism. Oral thyroid supplementation, so they give it to artificially provide adequate hormone levels after surgery or ablation. So once you remove the thyroid gland, or you cause ablation, which means you destroy it, and it's no longer functioning, we still have to have thyroid running through our body. It's important. It's part of our metabolism and keeping our overall homeostasis. So once the thyroid gland is no longer functioning, we have to be supplemented with thyroid. Methimazole, again, is the generic for Tapazole. It is a treatment for hyperthyroidism. And then the other one that we actually shorten and call PTU, obviously, because it's a lot easier to say. So male hormones, testosterone, okay. Testosterone is the key driver in those secondary male characteristics that we see. So the initiation of sperm production, behavioral characteristics, libido, sexual potency, also has to do with male fertility, muscle mass and strength, fat distribution within the body, bone mass, erythropoiesis, which is the production of red blood cells, and then the prevention of baldness. So the feedback mechanism for testosterone is the follicle stimulating hormone FSH is produced in the pituitary gland, and then also the luteinizing hormone is produced by the pituitary gland. Those hormones are released and targeted to the testes, which are responsible for releasing testosterone into the body. Disorders that are specific to males, so hypogonadism is a condition in which the body's sex glands produce little to no hormones. This can include breast enlargement for men, muscle loss, decrease in libido, and we will treat that consistently with androgens. So giving them a testosterone replacement, either an injection, a cream, or a gel. A lot of males will go to a compounding pharmacy and get them into like a troche, which is like a lozenge. Erectile dysfunction, known as ED,